Good afternoon, everyone. I'm Rebecca Barkley, Director of Public Relations for ETMC. We have some very exciting news to share with you today, but we have a short time frame of 30 minutes because we have a full day of visits to ETMC regional hospitals across the region. We'll have two speakers providing brief statements, and then we'll take a few questions. I'd like to first introduce our President and CEO, Elmer Ellis.
I was out there introducing myself. Thank you, Rebecca. It's a happy day. It's a good time. It's a good time for us and for East Texas. I'm going to stay close to this script so I don't forget something that I want to share with you. Healthcare systems across this country are changing as we speak, not just in East Texas, but everywhere. We've enjoyed being independent. We built a system of, at one point, 12, 15 hospitals, and a lot of clinics in the 40s. So we had a rather large system, and we had a rehab component. But times are necessary these days in order for us to survive and grow, to have a partnership. We realized that a couple of years ago. It's sort of similar to the way we took the side of small hospitals in small communities. And we really struggled to build beautiful facilities and recruit physicians to those small communities so they could have health care where they lived. Well, a couple of years ago it became obvious to us that we needed to find a strategic partner, and we began that process. I've never been through that before. It's new to me, and so I don't claim to have great knowledge in it, but we sought the advice of a Kaufman Hall, which is a firm out of Chicago that helps take you through this process. They've done a wonderful job, and we started looking for a partner who would share our values and as much as possible share our mission, what we were trying to do here, keep our system whole. After a rather long search and a lot of interviews of different people, we found organizations that would work with us. We found one, and we found a second one together. That was Ardent and UT. Ardent has a wonderfully successful history of operating hospitals. They are the experts, and they have the benefit of being a partnership with UT. The three organizations and our organization have signed a letter of intent to go through and close an operation that will include committing our assets to the partnership. Combination of these resources, along with the reputation of UT and the regional scope of ETMC, will add a new system exposed and expanded to our East Texas area. It'll bring a level of care that we would not otherwise be unable to bring, and it puts us in the level with UT Southwest, the UT Medical Branch, MD Anderson, and other renowned UT operations throughout Texas. I can't tell you how pleased I am that this occasion to perpetuate the thing that we have loved and built over the years in East Texas. And I want to introduce you today to the man who's going to head up that effort. His name is David Vanderwater, and I think you will love him. Thank you.
Thank you, Elmer, and I certainly appreciate the warm welcome that we have received since we have been in town, and we've had an opportunity to be around several of the facilities and meet a lot of people so far today. This partnership that Elmer just described brings together the very best of three organizations to form a new 10-hospital system. The new system will include East Texas Medical Center and its 9 hospitals and 39 clinics, in certain UT Northeast facilities, and there are 12 clinics, which if you think about that, that's 10 hospitals and 51 clinics around the state. Many benefits working together include expanding the medical education and research community health initiatives throughout this region. That means more training opportunities for the physicians and the nurses and other health professionals here in Northeast Texas. The system will become an affiliate of the world-renowned University of Texas system, as Elmer indicated, one of the largest academic health systems in the country, and includes MD Anderson Cancer Center and other nationally recognized organizations. That means increased access to high-end and specialty services close to home. To help achieve our vision for the future, Ardent has committed $150 million to invest over the next 5 years into the system. These dollars will fund new technology and services and programs and support the operations of this new system. Proceeds from the transaction that we provide will be used to create a local foundation to support our shared vision and shared mission of improving health and wellness for East Texans. The governance of the new system will be shared equally between Ardent and UT Health Northeast. We will also maintain local hospital advisory boards comprised of physicians and community members. Still, many details need to be worked through, but we're confident that the partnership will benefit the entire region. On behalf of both Ardent and the UT system, we're excited to be part of East Texas and the East Texas community. We look forward to building on a strong legacy of clinical excellence and community service for which ETMC is well known. I think Elmer and I would be glad to take any questions at this time. Elmer? Well, hopefully from the things that we've seen so far, we see that the opportunities that we have today will continue to be the opportunities that you have in the future. So, we believe that substantially all the employees will continue to be employed within this organization. Obviously, as we bring more services and to the organization through the University of Texas system and through the capabilities that exist here today, we believe that over time we will be able to grow the current employment to a larger number than exists today. That is certainly the anticipation. Well, I think the clear opportunity is that when you have organizations get together and they share resources, such as we're talking about from East Texas Medical Center, which has been in this community for a long time, and you have the University of Texas, which has been in this community for 70 years as well, that finding ways to work together and stop some of the out-migration that is leaving this community. And we believe that systems that get larger and have the kind of scale that this organization is going to have is going to put us in a much better position to retain those services so people do not feel it necessary to leave this community. And so it will be something that we do a lot of research on, make sure we understand where people are going for services when they do out-migrate for some of those services in other communities, whether that's Dallas, Shreveport, wherever it is. We need to make sure that people get to stay at home and receive the care. That's where we know people get better the closer to home they are, and the ability that they can have their family and friends close to them as they go through the healing process. Well, it's my lucky day. I think that's a guy like me that I've been doing this for 35 years. And so, first of all, it's rare that you have an opportunity to come to a community that has the system already established. I was telling some people earlier today that what we've created in Tulsa, Oklahoma with our Hillcrest healthcare system there, it's taken us about 14 years to get it to where it is today. What we're starting off with in this community is something that I would have died for to do early on in regards to what was going on in Tulsa, Oklahoma. So we have a significant head start because of the hard work that the board and Elmer and all the folks that have supported this organization have done over the years, and we believe that there's plenty more opportunities. While the network is going to start out as a 10-hospital network, that's not how it's going to end up. And I think if you look at the things that we've done from a company's perspective, we've gone in and we've identified opportunities to create a much larger network. We want those people that have medical needs in regards to this community, we want them to feel very comfortable that coming to this organization is the best place to come. I think that what you're seeing in regards to the establishment of an expanded network is what we're seeing in the rest of the United States today. And quite frankly, it's why we're getting phone calls today about other organizations seeking an opportunity to participate in this network. It tells you that going alone in this day and time is just not something that you can do. You need the scale in regards to whether it's the supply cost that you're trying to reduce or whatever it is, some consolidation of services so that you don't have to go out and buy every piece of equipment just to take care of your hospital in a particular location. So all those things are meaningful in regards to establishing that network and making sure that you're competitive and at the same time providing very good quality care. I mean, those are the things that are important, and we believe that we can add to what has been accomplished here over the last 70 years here. And we think that we're excited about having that opportunity and look forward to continuing the legacy of this organization and finding a way that we connect with this community going forward. Part of this will be the University of Texas opportunity to expand their capabilities. I mean, one of the things that if you think about the education process for medical students today, they need volume of patients. So the repetitiveness that goes into the educational process, quite frankly, comes from the scale that is provided with an organization such as this and the number of patients that flow through here. So we believe that the education process for the students is going to be enhanced through this process, and they seem to be excited. I was a little late, that's where I was. And we're excited about it also. We want to put them in an atmosphere where the learning experience that they encounter is one that's going to produce the best possible physicians in the United States. I don't have a specific answer in regards to the economics of it. Obviously, there will be taxes that we will be paying on a going forward basis. So that will be something that historically has not taken place given the tax status of ETMC today. So that will be something that we'll be discussing with the local leaders in regards to how that's going to work in the future. Thank you for your time. We appreciate your coverage, and thanks for getting the story out early.